The American Society of Clinical Oncology, which represents many of the nation's top cancer doctors, is calling attention to the ties between alcohol and cancer. In a statement published Tuesday in the Journal of Clinical Oncology, the group cites evidence that even light drinking can slightly raise a woman's risk of breast cancer and increase a common type of esophageal cancer. Heavy drinkers face much higher risks of mouth and throat cancer, cancer of the voice box, liver cancer, and, to a lesser extent, colorectal cancers, the group cautions. The message is not, don't drink. It's, if you want to reduce your cancer risk, drink less. And if you don't drink, don't start, said Dr. Noelle LoConte, an associate professor at the University of Wisconsin-Madison, and the lead author of the ASCO statement. It's different than tobacco where we say, never smoke. Don't start. This is a little more subtle. Other medical groups have cited the risks of alcohol as a possible cause of cancer. But this is the first time that ASCO has taken a stand. Drinking overall, as well as heavy drinking and problem drinking, are on the rise in the United States and affect all segments of society, including women, older adults, racial and ethnic minorities and the poor, several surveys have shown. Continue reading the main story. Related coverage. Well. Ask Well, Alcoholism and Depression Sept. 25, 2015. Well. Most heavy drinkers are not alcoholics. Nov. 2014. Personal health. Do we need to give up alcohol to lose weight? Not necessarily. March 13, 2017. Recent comments. Bose 2 hours ago. Heavy drinkers face much higher risks. Okay, ASCO is a great org, but this is just stating the obvious. Alcohol is a depressant, so it seems. Douglas Johnston 11 hours ago. What about alcohol in mouthwash? Casey 11 hours ago. I am more worried about getting hit and killed maimed by a drunken driver. Now there's a problem. So tired of alcohol-induced idiots behind. See all comments. Write a comment. Advertisement. Continue reading the main story. Yet few adults, when asked, identify alcohol consumption as a risk factor for cancer, even though the vast majority were familiar with other cancer risk factors, like smoking and sun exposure. A recent ASCO survey of 4,016 adults found fewer than 1 in 3 adults identified alcohol as a risk factor for cancer. Most also failed to mention obesity as a risk factor.